The 4 days conference that has commenced today at Speaker Resort Munyonyo is under the theme Harnessing Data Science and Artificial Intelligence for African Genomics. The conference is meant to ensure that scientists, policymakers and industry experts reinforce partnerships that will define the future of genomics research Africa.
Makerere University is privileged to be part of this initiative. It is an international conference that has drawn scientists from all over the world. And basically, this is about studying genes and how the studies can be used to treat people, using medicine and the other scientific discoveries.
While officially opening the conference, Vice Chancellor Makerere University Professor Barnabas Nawangwe said that the conference seeks to bridge the research gap by fostering strategic partnerships and adoption of verifiable data-driven approaches towards addressing health challenges.
Uganda, this is extremely an important initiative. As you know, Uganda's population is growing very fast. And there are two things that we as a country must do in preparation for this huge population. One, we must be able to maintain a healthy population through treating diseases, but maybe also through prevention of the diseases. Secondly, we must be able to feed this population. As a first thing, even if we don't do anything else, these people must have food to eat. So Makerere University is participating with universities around the world to look for solutions to those two things: medicines to treat our people, or to see how we prevent diseases, and then how do we feed this big population that is coming up, not just in Uganda, but in Africa.
Nawangwe adds that scientists will feature impact discussions on genomics insights into rare and common diseases to improve early diagnosis and precision medicine.
I am delighted that our scientists, who are some of the best scientists actually in this area, except that they don't have the same facilities that scientists in the more developed countries have, are working very hard to ensure that we get these studies done. But I must say that even within Uganda here, we have made quite considerable progress in developing the infrastructure. The government gave us a lot of equipment, especially during COVID-19, when we were trying to look for solutions to COVID-19. Many of our laboratories were actually modernized. But I want to urge the government to continue supporting the universities, particularly Makerere University, where most of this resource, most of the capacity is actually found, to make sure that we build capacity for our country to come up with innovations to solve the problems that I've talked about.
Minister of Science and Technology Dr. Monica Musenero, who was represented by Dr. Cosmas Mwikirize, said that many diseases that affect Africans have genetic components. Therefore, the conference is very important in pushing for increased research.
Africa is uniquely placed. It is the birthplace of modern humans, and it has the most genetically diverse population on Earth. And this diversity provides an invaluable resource for understanding the genetic basis of diseases. And moreover, we know that many diseases that disproportionately affect Africans, such as sickle cell disease, malaria, HIV, TB, and certain cancers, have genetic components. Therefore, studying African genomes can help identify genetic resistance to diseases and inform breakthroughs in treatment and drug development. Moreover, through your work, you're contributing, and this is important from the perspective of AI, to address potential creeps of biases in this area.
Meanwhile, Health Minister Dr. Jane Ruth Acheng, also represented by Professor Moses Joroba, commended the organizers for bringing experts in Uganda to discuss issues of addressing health challenges in Uganda, Africa and beyond.
This is a landmark event that highlights the critical intersection of genomics and health across the African continent. I commend the organizers for bringing together such a diverse group of expertise, leaders and innovators from across the world. As the Minister of Health in Uganda, I have witnessed firsthand the immense potential that genomics holds in transforming the healthcare landscape.
The conference is also marking inauguration of the first Uganda Society for Humanogenetics and Bioinformatics. Julius Mhumuza, Church of Uganda Family TV, News at 8.